Round the world, populations are aging at an unprecedented rate. In 2000, only 7% of the global population was over 65, but by 2050, this figure is expected to reach nearly 16%. This shift is driven by declining birth rates and increased life expectancy, resulting in a larger proportion of older adults than ever before. While industrialized nations have historically led this trend, developing countries are now experiencing the fastest growth in their elderly populations. This demographic change presents new challenges and opportunities for societies, especially in terms of healthcare and nutrition. Understanding these trends is crucial for planning effective public health strategies. As people live longer, the prevalence of chronic degenerative diseases rises. Infectious diseases have declined thanks to medical advances, but conditions like heart disease, cancer, diabetes, and Alzheimer's are now leading causes of death among older adults. In Europe, about 95% of disease burden in those over 60 is due to chronic illness. These diseases often reduce quality of life, limiting physical and mental abilities and increasing the need for care. Managing these conditions requires a focus on both prevention and effective nutritional strategies to support healthy aging. With age, many adults experience limitations in their ability to perform daily activities. These can range from basic self-care tasks, like feeding and hygiene, to more complex activities such as managing finances or transportation. Chronic diseases often contribute to these limitations, increasing the risk of dependency and institutional care. In the U.S., about two-thirds of older adults report difficulty with at least one daily activity. Maintaining independence and quality of life becomes a central goal, highlighting the importance of nutrition and overall health management. To assess the health of older adults, tools like disability-adjusted life years, DALYs, are used. DALYs measure years lost due to poor health, disability, or premature death, providing a way to compare health status across populations. While life expectancy has increased, the number of healthy life years often remains unchanged, meaning many older adults spend a significant portion of their lives in poor health. This underscores the need for interventions that not only extend life, but also improve its quality. Despite longer lifespans, many older adults face increasing rates of diseases like diabetes and physical limitations. In Europe, millions of older adults live with diabetes, and in the U.S., nearly 30% of older adults are diagnosed with the condition. These health issues often lead to a downward spiral, where poor health begets further decline, including poor nutritional status. Preventing and managing these conditions is essential for maintaining quality of life in older age. Nutrient requirements for older adults are established by organizations like Health Canada, the Institute of Medicine, and the World Health Organization. These standards, such as the Dietary Reference Intakes, DRIs, provide guidelines for macronutrients and micronutrients by age and gender. They form the scientific basis for food guides and nutrition education, ensuring that dietary recommendations meet the needs of older populations. Regular updates and reviews help keep these standards relevant as new research emerges. As people age, their energy requirements typically decrease. This is due to a lower resting metabolic rate and reduced physical activity. However, energy intake does not always decline at the same rate, leading to an increased risk of overweight and obesity. In the U.S. and Europe, obesity rates among older adults have risen significantly in recent decades. Achieving energy balance is crucial, as both excess and deficient energy intake can lead to health problems, including chronic diseases and frailty. Unique condition in older adults is sarcopenic obesity, where excess body fat coexists with low muscle mass. This combination increases the risk of disability, frailty, and poor quality of life. Sarcopenic obesity results from age-related muscle loss and changes in body composition. Addressing both weight control and muscle preservation through nutrition and physical activity is essential to reduce the impact of this condition. While obesity is a concern, some older adults are underweight, with very low body mass indexes. This can lead to protein, energy undernutrition, increasing the risk of frailty, infections, and mortality. Often, undernutrition is linked to poor dietary choices, such as consuming energy-dense but nutrient-poor foods. Public health guidelines encourage the consumption of nutrient-dense foods to meet vitamin and mineral needs without excess calories. Protein intake tends to decline with age, but maintaining adequate protein is vital for muscle mass and overall health. Recommendations generally suggest 0.8 grams of protein per kilogram of body weight per day, though some experts advocate for higher intakes in older adults to prevent muscle loss and frailty. Protein quality, timing, and supplementation may also play roles, especially for those with chronic illnesses or at risk of malnutrition. There is ongoing debate about whether older adults need more protein than current recommendations suggest. Some studies indicate that higher protein intake supports better function and muscle mass, while others find no clear benefit. The issue is complicated by individual health status, disease presence, and the risk of kidney disease in some. Until more research is available, most healthy older adults in developed countries meet or exceed basic protein needs, but frail or ill individuals may require special attention. Alcohol affects older adults differently due to changes in body composition and metabolism. Even moderate drinking can lead to higher blood alcohol levels, and interactions with medications are common. While older adults generally drink less than younger people, alcohol abuse remains a concern for a minority. Excessive alcohol intake can worsen chronic diseases and contribute to poor nutrition, making screening and intervention important in this age group. Vitamin B12 deficiency is more common in older adults, not because of lower intake, but due to absorption issues. Conditions like atrophic gastritis reduce stomach acid, making it harder to extract B12 from food. Deficiency can lead to anemia, nerve problems, and cognitive decline. Older adults are advised to consume fortified foods or supplements, and regular screening can help prevent complications. Vitamin D is crucial for bone health, but older adults often have lower levels due to reduced skin synthesis and kidney function. Deficiency increases the risk of osteoporosis and fractures. Dietary intake, supplements, and moderate sun exposure are recommended to maintain adequate vitamin D status. There is also ongoing research into vitamin D's role in immunity and chronic disease prevention. Calcium is essential for maintaining strong bones and teeth. As people age, calcium absorption decreases and bone loss accelerates, especially in postmenopausal women. Adequate calcium intake, through diet or supplements, helps reduce the risk of fractures and supports bone health. Public health efforts focus on making calcium-rich foods accessible and encouraging their consumption among older adults. Assessing dietary intake in older adults can be challenging due to sensory and cognitive changes. Vision and hearing loss, as well as memory issues like dementia, can make it difficult to collect accurate dietary information. Caregivers may need to assist with record-keeping and interviews to ensure reliable assessments. Overcoming these barriers is key to identifying nutritional risks and needs. Measuring height, weight, and body mass index, BMI, in older adults can be tricky due to age-related changes like scoliosis and height loss. While BMI cutoffs remain similar for all adults, some evidence suggests that a slightly higher BMI may be protective in certain chronic conditions. However, the relationship between weight and health outcomes in the elderly is complex and sometimes controversial. Biochemical markers, such as serum proteins and nutrient levels, are used to assess nutritional status. However, in older adults, these markers can be influenced by medications, illness, and hydration status, making interpretation challenging. For example, low serum protein may reflect illness rather than poor nutrition. Careful evaluation is needed to distinguish between nutritional and non-nutritional causes of abnormal lab results. Older adults often take multiple medications, which can affect nutritional status by altering appetite, absorption, or metabolism of nutrients. Some drugs may increase the risk of dehydration or interact with key vitamins and minerals. Monitoring medication use is an important part of nutritional assessment and care in the elderly population. Traditional health outcomes like morbidity and mortality rates are important, but for older adults, quality of life and functional status are equally significant. Measures such as frailty and well-being provide a more holistic view of health. Public health efforts are increasingly focusing on these broader outcomes to guide interventions and policy. Frailty is a clinical syndrome marked by weight loss, weakness, low energy, slow walking speed, and low physical activity. Meeting 3 or more of these criteria indicates frailty, which increases vulnerability to negative health outcomes. Identifying frailty early allows for targeted interventions to improve health and prevent disability in older adults. Older adults face higher nutritional risk due to factors like disease burden, limited access to food, and changes in appetite or metabolism. Malnutrition can lead to muscle loss, delayed healing, infections, and increased mortality. Many cases go unrecognized, making screening and early intervention essential for preventing complications. Screening tools like the Nutrition Screening Initiative, NSI, Mini Nutritional Assessment MNA, and Malnutrition Universal Screening Tool, MUST, help identify older adults at risk of malnutrition. These tools use simple questions and measurements to flag individuals who need further assessment or intervention. Regular use of these tools in community and healthcare settings can improve detection and management of nutritional problems. A comprehensive nutrition assessment includes medical and dietary history, physical examination, anthropometric and laboratory data. Tools like the Subjective Global Assessment, SGA, and the ABCDEF mnemonic guide clinicians in evaluating nutritional status. This process helps identify problems and tailor interventions to individual needs. Anthropometric measures like weight, height, and BMI are simple and non-invasive ways to assess nutritional status. However, age-related changes can affect accuracy. Unintentional weight loss or significant changes in BMI are warning signs that should prompt further investigation. Other measures like skin fold thickness may be less reliable in older adults. Biochemical tests provide objective data on nutrient status, but must be interpreted carefully in older adults. Clinical assessments, including medical history and physical examination, help identify signs of malnutrition or dietary excess. Oral health, medication use, and chronic diseases all influence nutritional status and should be considered during assessment. Understanding an older adult's food intake, supplement use, and medication regimen is crucial for assessing nutritional risk. Food records, recalls, and questionnaires can reveal patterns like meal skipping or poor variety. Some medications can suppress appetite or alter taste, further complicating nutritional status. Socioeconomic status, cultural beliefs, and family dynamics all influence dietary habits in older adults. Changes in income, living situation, or social support can impact access to nutritious foods. Recognizing these factors helps tailor interventions to individual needs and circumstances. Assessing an older adult's ability to perform daily and instrumental activities is key to understanding their nutritional risk. Difficulties with meal preparation, shopping, or self-feeding can lead to inadequate intake. Functional assessments guide the need for support services or interventions to maintain independence. The Nutrition Care Process Model, NCPM, provides a structured approach to nutritional care, including assessment, diagnosis, intervention, and monitoring. This model ensures that care is systematic and evidence-based, improving outcomes for older adults. It is widely used in the US, Australia, and Europe as a standard for nutritional care. Demographic and health statistics help identify groups of older adults at higher nutritional risk. Community-level screening can reveal vulnerable populations, such as the oldest old or those with disabilities. Targeted nutrition programs and policies can then be developed to address these needs and improve public health outcomes. Many older adults live independently, but malnutrition can still occur in this group. Regular screening and monitoring by healthcare professionals and caregivers are important, even for those who appear healthy. Early detection of nutritional problems can prevent hospital admissions and improve quality of life. Older adults in sheltered housing receive some support, but nutritional risk remains. Regulations often focus on food safety, with less emphasis on nutrient quality or assessment. Many residents depend entirely on facility-provided meals, making food quality and regular screening essential to prevent malnutrition. Malnutrition rates are highest among older adults in residential care and nursing homes. Strict regulations require facilities to provide age-appropriate, nutritious meals and monitor residents' nutritional status. Despite these measures, disease-related malnutrition can be difficult to reverse, highlighting the need for comprehensive care and regular assessment. Initiatives like Healthy People 2020 in the US and Health 2020 in Europe set goals to improve function and quality of life for older adults. These frameworks include nutrition-related objectives and support policies to increase healthy life years. Achieving these goals requires coordinated efforts across healthcare, social services, and community programs. Effective nutrition interventions range from individual education to community meal programs. Education helps older adults make healthier choices, while services like Meals on Wheels provide nutritious food to those who are homebound or at high risk. Interventions are most successful when tailored to the specific needs of individuals or groups. Contrary to common belief, many older adults are willing and able to change their dietary habits. Nutrition education is most effective when focused on simple, practical messages tailored to individual needs. Programs like Fit as a Fiddle in the UK have shown that targeted education can improve eating habits, physical activity, and mental well-being. Community-based programs, such as the Supplemental Nutrition Assistance Program and home-delivered meal services, play a vital role in supporting older adults. These programs target those at highest nutritional risk, providing not only food but also social support and health monitoring. Legislation and quality standards vary, but the goal remains to prevent malnutrition and promote independence. The population of adults over 85 is growing rapidly and faces unique challenges. Frailty, disability, and high care needs are common in this group. Health promotion, frequent nutrition screening, and tailored interventions are essential to minimize risks and support healthy aging in the oldest old. Public health and social welfare programs often prioritize younger populations, but with global aging, there is a need for more comprehensive investment in older adults. Supporting aging in place, rather than institutionalization, requires robust infrastructure and policies that address physical, mental, and social needs. New research is exploring the role of the gut microbiota in aging and nutrition. The effects of diet, disease, and medications on the microbiome are only beginning to be understood. Functional foods and ingredients with health benefits beyond basic nutrition are also being studied, with projects underway in both Europe and North America. Older adults are a nutritionally vulnerable group with unique needs. Chronic and acute diseases, changes in functional status, and social factors all influence their nutritional health. Addressing these challenges requires routine screening, assessment, and targeted interventions at both individual and community levels. There's a clear association between diet and disease in older adults. Poor nutrition can worsen existing health problems and increase the risk of new ones. Managing diet-related complications, such as frailty, requires a coordinated approach involving healthcare providers, caregivers, and community resources. Implementing routine screening and assessment for nutritional risk in older adults is vital. These practices help identify those in need of special care and guide interventions to improve health outcomes. Both individual and community-based approaches are necessary to address the diverse needs of the aging population. As the global population continues to age, nutrition will remain a cornerstone of healthy aging. Ongoing research, policy development, and innovative interventions are needed to meet the evolving needs of older adults. By prioritizing nutrition, societies can help ensure that more people enjoy longer, healthier, and more independent lives.